This is a respiratory disease that makes it difficult to clear mucus from the lungs due to damaged airways. As a respiratory therapist or medical professional, it's a condition that you must be familiar with. A condition that causes irreversible destruction to the bronchial walls of the airways of the lungs that results in an accumulation of copious amounts of bronchial secretions. The most common causes of bronchiectasis include the following: smoking tobacco or cigarettes, cystic fibrosis, lung infections, autoimmune disorders, congenital disorders, and a foreign body obstruction. You should note that most cases of bronchiectasis stem from cystic fibrosis. Now let's talk about the signs and symptoms. The signs and symptoms of bronchiectasis can vary in severity from person to person. Here are some of the most common examples. The patient may have a chronic cough, large amounts of green or yellow sputum, wheezing, shortness of breath, chest pain, coughing up blood, atelectasis, and cor pulmonale. There may be other signs and symptoms of bronchiectasis. These are just a few of the most common examples. So how is bronchiectasis diagnosed? There are several things to look at when diagnosing a patient with bronchiectasis. Here are some of the most common examples. You will need to look at their CT scan, immunoglobulin levels, sputum culture, pulmonary function test, and a complete blood count. The physician may recommend a sweat chloride test if cystic fibrosis is suspected. So now let's talk about the treatment methods. Ideally, it's best to strive to prevent bronchiectasis. However, it can be managed by taking a comprehensive approach. Here are some of the general methods for treatment and management: airway clearance therapy, anti-inflammatory medications, bronchodilators, antibiotics, mucolytics, chest physiotherapy, pulmonary rehab, oxygen therapy, and vaccinations. Again, patients with bronchiectasis are treated on a case-by-case basis, and the methods can vary depending on the severity of their symptoms.